Okay, we are live. Let's see who pops by today for a bit of a visit. I missed last week because I was not doing well, so I am back today. And hopefully everybody got the memo. I have a new flower crown that I got off Etsy. So that's exciting. Oh, somebody's here. Katie. Hi. Oh, I look so pretty. Thank you. I got this new flower crown and it's like a gold, like normally they're all like $20, but this was like I think it's like a handmade piece off Etsy. And I was like, I'll put it on today. See how people feel about it. How's it going? How was your week? I feel like everybody should get their flower crowns out and we should just do a group flower crown call. I have a few now. I'm working on my flower crown collection. It's just so fun. I didn't know we were allowed to just wear flower crowns whenever we want. That wasn't put on the grown-up handbook. But the fun part about being a grown-up is you can kind of do what you want. Katie says, "Oh my god, group flower crown call." Yeah, like we should just Do you have one, Katie? Or like a tiara or a sparkly headband or something? Um, Katie says a flower crown might make work more fun. Yeah, I believe it. I mean, it's not very professional, I guess, but it's like magical. So, I think that might improve the work environment. Oh, you don't, but you need one. Okay. I'm working on my collection, so I can advise if you need a place to know where to go to find them. They are a little more ubiquitous than you would think, actually, and they're not that expensive. Most of them are like you can get a cheap one from like Claire's or the dollar store for like $15, maybe $20. But now that I've had a few and I see the wear and tear they get, I'm like, okay, I could up level a little bit. And plus, this one has purple and gold, so I couldn't say no. Oh, we have two people in. Welcome in. I wonder if this is Susan. Um, yeah, I think everybody needs flower crowns. I didn't think, yeah, here, I have a sparkle headband. I'll show you what this one is. So this is my flower crown, and this is a sparkle headband. So it's like still professional, I think. I mean, like a headband's professional, but it's just like sparkly, you know? Cheryl, hi. You're back. How are you? How have you been? I haven't seen you for a while. How was your week? Katie says, I feel like the gold on the flower crown really adds a touch of fancy. Yes, I agree. But anyways, this is like a more acceptable like work culture solution if you need a little sparkle. I'm going to go back to my full on flower crown. Ah. Nope. There we go. I mean, I just feel like then I could be like some kind of fairy queen or of something, you know? Like you need a dress that matches this, maybe. I guess with the hoodie, it's like less convincing, but um, yeah, sometimes you need something that's going to make you stand a little taller and have more of that energy, more of that queen energy. Um, Cheryl, what's new with you? I haven't heard how you've been doing. I just started filming. Well, I finished filming uh, 10 or 11 videos on how to calm down when you're freaking out and when your nervous system is like just totally on meltdown. Um, so I'm excited to start putting those up. Katie says the flower crown with a fun summer dress would be perfection. Ooh, yeah, you're right. I think once the weather turns and we're into like summer dresses, this has gotta match one of them, you know. You just like walk in and you're like, yeah, jealous. You didn't know we were allowed to wear flower crowns, did ya? Cheryl says I'm doing well. We were on vacation and then had a tornado, lost power, so been out of touch. Oh my goodness. A tornado. That sounds terrifying. Well, I guess losing power is one thing, as long as the tornado didn't come to your house. Um, Cheryl, where are you? If you have a tornado, I assume you're in the US somewhere. Well, we missed you anyway, is what I wanted to say, Cheryl. And I'm glad you're back. Um, I was off last week anyway, so you didn't miss anything. Um, Michigan. Really? They have tornadoes in Michigan. I thought it was more of like a Kansas kind of thing. Michigan. Okay. Okay. Well, how was your vacation? I hope it was fun. I hope it was I was just talking to somebody today about going on vacation, but they're so like kind of numb and feeling like they have to be productive all the time and like always working on the next thing that that they just struggle on vacation, that they like can't relax and they can't like just be present in the moment and focus um on what needs attention. They're just like always on their phone or like working. So when people say they went on vacation, like that could be amazing or it could be like an exercise in frustration. You never know. Cheryl says we went to Florida and vegged. Okay, well that sounds lovely. Katie says the weather in the US is out of control. Yeah, I was talking to someone in Colorado and they said that it was like 30 degrees Celsius, which is like a hot summer day. And it's like March and they're like putting on the air conditioning. Shit, it was like 85 Fahrenheit, which is just unbelievable. Like it's like parts of the US are just not getting winter at all. Which is yeah, it is wild. It makes me nervous. There's tons of winter here. If you're worried that winter is gone everywhere and it's never coming back, like there's a lot of winter happening in Nova Scotia. There's like a blizzard out right now. So, um, Susan says it's 27 Celsius in Northern California. Oh my goodness. Like that's like a hot day. That's like you're not even wearing a sweater. That's like you're not wearing a coat, you're not wearing a sweater, you're wearing a t-shirt, and if you're in the sun too long, like you're actually hot. That's not normal, right, Susan? That's crazy. I mean, even for Northern California, that's crazy. Um, yeah, that makes me nervous. I don't know what to do with that. That's like Hawaii, Susan, isn't it? It's like you're getting your wish to miss out on winter. I did that once. I didn't know anything about manifesting, but I was 16 and I had just started dating my first boyfriend, and he lived like maybe an hour and a half away from where I live, 2 hours away. And I was like, "Oh, like we were able to see each other because it's summer, but once the snow comes." And I had prayed for tons of snow the year before because I had just started skiing and I really wanted the snow. So then this year I had this boyfriend and I really wanted to see him, and he's like, "Well, depending on the snow, like we might not see each other for like a month at a time depending on how bad the roads are." And so I was like, "No snow, no snow, no snow, no snow." And that winter it barely snowed and all the skiers were so mad, and I was like, "Yeah, I get to see my boyfriend." So be careful what you wish for because you might just get it, is what I learned in grade 10, 11, 12. Um, okay, so Cheryl says, I want to ask Susan if she has used her vagus nerve stimulator. Ooh, I want to ask Susan that too. It's a great question. Susan, have you used it? Does it work? Does it help? How does it work? Katie says Friday it got up to 101. So America has a fever. Like, isn't 101 a fever? That I am. It's March. What are you guys going to do in August? That makes me very uncomfortable. So Friday got up to 101. Yesterday it was 98, and today it is 60 and windy. Okay, so it's getting hot, but it's not staying hot. Um, Susan says, I haven't used my Pulsetto for a while. I'll put it on right now. Okay, and when it's on, explain what it is, please, and how it works. That's fascinating. Katie said, I will be sad May through September because it's going to be what, 140? Like, how hot is it going to get if it already has a fever? Like, you know what I mean? How much hotter can it get when it's actually summer? I mean, don't get me wrong, I am a little jealous. I'm concerned, but also a little jealous, you know? It's like when someone's on a GLP-1 that you know and they've lost a ton of weight and they look amazing and you're like, I'm concerned for you and a little jealous at the same time. like like I wish I could go out without a huge winter coat on. Um I wish that even going for a walk outside would be an option. Um, Katie says, I'm afraid of how hot it is going to be this summer. How hot is it normally, though? That's what I want to know. Like, is it normally 101 in the summer? Is it normally like 140? Like, what's normal other than just a setting on your dryer? Um, Cheryl, how are you feeling now that you're home from Florida? Because I assume Michigan is not Florida weather. Like, did you go on vacation and veg out and now you're all relaxed? Or do you have a vacation hangover where you went and vegged out and relaxed and now you're back in the cold winter and you're like feeling like you really miss it, you know? Uh Katie says 101 is normal for summer. Okay, but doesn't that imply then that it's going to be hotter than that? It would feel like as the seasons change, like it's going to get hotter. Okay, that's alarming. But let's focus on what we can control because the weather is not within our purview. So, for example, we can control our flower crown situation. That is within our control. Katie and I have been discussing a group flower crown call where we all put on our flower crowns and feel like fairy princesses, which I think would be really fun. Um, Susan's vagus nerve stimulator, calmer downer thing, that's within your control. Like we have to focus on what we can do with ourselves because there's just way too much going on that we can't control. Susan says fun. Yours is beautiful. Thank you. This one is new. I just got it. It has little butterflies and leaves. And it's like, well, it's not real gold, but it's you know, it's not as cheap as I usually go. Okay. Susan says Pulsetto is a wearable neck device designed to stimulate the vagus nerve using electrical impulses to reduce stress, anxiety, and improve sleep. Okay. Does it work? Does stimulating the vagus nerve help you calm you down? I would assume so. That's why like humming works. Singing is really good for your vagus nerve too. But I guess they've also invented a wearable neck device, so we've got a lot of options of how to soothe our vagus nerve. Does it work, Susan? Or what's your like assessment of it? I feel like if I was like having a nervous system meltdown and like hyperventilating crying, I don't know how I would feel about wrapping something around my neck. That sounds like a little bit of added stress. Susan says have to put electrode gel on and it has a bit of vibration. Okay, so yeah, so it's a bit high maintenance. I was using it a bit, but then I stopped when I went traveling. Okay. All right. Well, keep yeah. Susan says I haven't used it a lot lately, but gonna try using it again to evaluate. Okay, yeah. So keep an eye on it and let us know. I mean, if it works. Although I will say gel, electrode gel, that stuff is cold, and then you're putting stuff on, and then you're putting like you know what I mean? It's a bit of a faff, which is British for like a fuss, all fuss and muss. So if I'm like really freaking out, I don't know that I'm going to be like, let me stop crying long enough to put the gel on, stick the pad on, put the device on. Um, but I'm glad it exists. I'm glad somebody's designing these things because it's important that we can find a way to settle ourselves with anxiety for sure. Bit of an anxious, more anxious time. I guess it already was kind of anxious, but Susan says, "Yep, the gel is icky feeling. Yeah, that doesn't sound nice." She says, "I don't use it when I'm upset, but was hoping if I used it daily, it would help with sleep." Okay, yeah. What help your sleep? How? Like fall asleep earlier, stay asleep through the night, sleep deeper, wake up more refreshed. Like what kind of sleep assistance do you need? Cheryl says, fairly relaxed, but now need to remember how that feeling felt. They now have VNS, vagal nerve stimulator, I assume, that can be surgically inserted in your neck like a pacemaker. Whoa, why would you want it surgically? Why would you want that in your neck? Hmm. Um, like for people with really severe anxiety, like it's that effective that they've invented a version of it that is an implant. Never heard of that. How do you know about that, Cheryl? I'm fascinated. um and yeah, need to remember how the feeling felt. Yeah, it's like people can be relaxed on vacation, but then when they get home, like it wears off pretty quick. Susan says, I think the maker of Pulsetto did it for his wife because she had bad migraines. Okay, so stimulating her vagus nerve improved the migraines. I could see that. I could see that. Um, Surgically implanting something in your neck, though, I mean, you would have to be really struggling with anxiety to go to that length, like putting anything surgical in your body is dicey. Although I am a little worried about it now because I now have something surgically implanted in my body. I have 2 plates and a screw. So I'm hoping that doesn't cause problems. Susan said, so that is why the surgical ones were for those head migraines. Oh, okay. So it's not anxiety that they're getting it. It's for migraines. Okay. Migraines are like their own special kind of hell. I've only had one migraine in my life. It's like that kind of headache where you want to throw up and you're super light sensitive. And it was just a nightmare. It was people who get migraines, they're like, oh, I get like migraines once a week or a couple times a month or whatever. And I'm like, how do you live? Like that was absolute misery. Have you guys had a migraine before? Like that I grew up with a kid who was prone to them and he would be like in his bedroom with the lights out, with a thing over his eyes, with a bucket next to him for throwing up. Like it's like having a bad flu, but it just keeps coming back all the time. Like you're never done being sick. And then like stress and um some big event happening and then people like, oh no, I'm getting a migraine. And then they're like out of commission and they're miserable. It's horrible. I'm so glad I don't get migraines. I don't get headaches really either, although I may get one after trying to wear this for an hour. I've never actually tested it out. Um, but Katie says, I get one migraine a month. A month. Is that tied to your cycle, Katie? Or you don't have to answer that if that's too personal. But I know some women that it is to their cycle. Your first migraine was in 5th grade. You're like 10 years old in 5th grade. Oh my God. So you've been getting them for like 30 years every month? Cheryl says the implant thingy is stroke rehab, spinal cord injuries, epilepsy, migraines, and cardiac issues. Cardiac issues in your neck. Well, you learn something new every day, kids. I had no idea that was. I didn't even know people were working on that. That's awesome. Um, yeah, I guess anything that needs your body to relax would be like beneficial. Like it's really hard to calm down when you can't calm down. Katie says totally tied to my cycle, dramatic weather changes and stress. So could you get more than one a month, Katie, if like something really stressful and unforeseen happened and there was a bad weather change, like could you just get one out of the blue? I mean, that just feels like your body's holding you hostage. How does it feel, Katie? Like, or is it predictable? Like, do you know, like on the first day of my cycle, I'm definitely going to get a migraine and that's like, and you like plan for it? I don't know. I feel like that is to me, that would be like an overwhelming problem. Katie says yes, so you could just get one like if bad things happened. I know a few people actually who they get cold sores when bad things happen or when there's a lot of stress. They'll have like a cold sore breakout. Um and I thought that was just like a canker sore, like on the inside of your mouth, which I did have once in grade 4, and it was horrible. Um and if you eat anything sour, it burns. And like when you brush your teeth and you bump into it, it's horrible. It was like blinding pain. But they get them from stress, and it could be like inside or outside the mouth. But then it comes with this whole emotional hangover. They have like they just feel terrible about themselves. They have like low self-esteem. They're super sensitive to criticism. It's just like a very delicate time. So there's like an emotional impact, not just a physical impact, which I didn't realize either. So a migraine is kind of both, right? It's like a physical and emotional. Is it emotional, Katie, or is it just physical? Um, I don't know. I don't get them, so I don't know what if it has that type of emotional fallout the way like cold sores can for people. See, these are the things that make us grateful, right? When you don't have it. Like I'm walking around being jealous. I'm not walking around, but I'm looking at everyone else walking around being jealous of how well everyone else is walking because it hasn't occurred to me that walking is not a thing to be taken for granted. And then other people who have migraines are looking at me being like, oh, she doesn't get migraines. I'm jealous. So everybody's looking at everybody else for something. Katie says, I know when a headache is going to turn into a migraine. Oh, you get headaches and migraines, Katie? What? I take my prescription as soon as possible. Oh, there's a prescription for a migraine? Okay. A migraine starts very different than just a headache. I usually force myself to vomit. Oh my God. Katie says 100% emotional in addition to physical. Is it just me, or is this a thing people aren't talking about? Are women just like struggling with migraines and like you don't hear about it? I only hear about it like in pop culture when it's a TV show and someone says you're going to give me a migraine if you keep bothering me about this topic or whatever, but you don't actually I don't hear this being like discussed as a thing people are suffering with. I'm glad there's medicine though. I'm glad you can get a prescription for it. So a headache can turn into a migraine, but a migraine is not just a headache. Okay. It's like how uh, it's like how all jet skis are. Oh no, I'm lost. I'm losing the analogy. All hot tubs are. No, you have to know the brand names to do this. All facial tissue, all Kleenex is facial tissue, but not all facial tissue is Kleenex. There you go. You gotta have a brand in mind if you're gonna make that analogy. Katie says, my mom and sister also suffer from migraines. I've only met one male that suffers from migraines regularly. Yeah, the kid I knew back in the day was a boy, which I think I thought was unusual. Maybe it is something connected to cycles and women being women. Like, that's brutal. Susan said, my friend had one every month until menopause. That's like that's like 40 years. That's awful. Another gets them occasionally and has to lay down and nap. Wow. See, I used to under stress, I used to like faint. And that I described it as like my body was like we're turning you off and back on again. Like we are unplugging you. Like you're done. But I feel like a migraine is your body like punching you in the face and being like going to war with you a little bit. That sounds very painful and violent. I'm so sorry, Katie. That's horrible. Um yeah, okay. I do know of somebody who had I think she had like 12 migraines a month or something. Like it was ridiculous. It was like every other day almost. And then she did a bunch of like inner child healing and she never got them again because it was much like there's a lot of ways that our littles like slow us down and protect us and be like, no, you're not safe. I'm making the executive decision. Um, like migraines are a way that they can do that in your body. So, so they can when you hear what they're upset about and what they think they need to protect you from and stuff, then they don't keep flipping that switch. So, yeah, it's not just like a physical problem. It has like an emotional component, emotional base, so then it makes sense that like there'd be some emotional healing that might help it, if that makes sense. Katie says, I am blessed. It is only once a month. I mean, yeah, like in that context, it could be worse. Cheryl says, I have trigeminal neuralgia, like a migraine of 4 or 5 constantly. Then sometimes spikes to an 8 or a 9 with weather changes. What? Cheryl, is neuralgia like nerve pain? Trigeminal. What does that mean? I don't know those words. No, I thought neuralgia was some kind of nerve pain where like there's not a physical problem, but the nerve is like just pressed for some reason. So Cheryl, all the time you feel like you have like a mid-range migraine all the time? Like a headache and nausea and all that? I mean, what's 8 or 9? I mean, Cheryl, how do you do anything? How do you So right now, Cheryl, you feel like you have a mid-grade migraine? Katie says, Cheryl, I'm so sorry you have to go through that. Yes, Cheryl, I'm very sorry. That's awful. How do you live? Can they give you medication? Like how do you go to Florida and veg out when you always have a migraine? Katie says dealing with my father has been known to trigger a migraine. Yeah. Yeah, so then I guess maybe you'd have to be a lot more selective about the people that you engage with if a migraine is going to be the outcome, right? Like if those are the stakes, I think I would have had much better boundaries with people if I was going to end up with a migraine. Cheryl, I'm shocked and I don't understand, like how do you function? How do you relax? How do you rest? Cheryl says, like I was hit in the eye socket with a softball. Oh my God, that sounds horrible. So it is like a nerve pain thing? Like it's just always turned on. Like you just always have a headache. I, I what I mean, I guess the doctors can't. I'm sure you've gone and they can't help you. Anthony's here. Hi. Anthony, welcome in. Sorry I missed you last week. Anthony says, hello, Helmi peeps. Anthony, get out your flower crown. We're having a flower crown group call. This is mine. Get out your emergency responder flower crown. Katie says, hugs to you, Cheryl. Oh, you know what? Anthony's a paramedic. Maybe he can help. Cheryl says drugs. So Cheryl, okay, so hang on, let's go back. Anthony, Cheryl has trigeminal neuralgia, where she always feels like she has a migraine. Um, what what is that from? Do you know anything about that? That sounds horrible. Cheryl, I am holding so much space for you. That is, I mean, that would just, do the drugs take it away or do the drugs just make it less worse? Like, because how do you laugh and how do you relax and how do you read a book or like, how do you have any downtime if there's just always pain? Do you know what it's from, Cheryl? Hmm. Anyway, I'm really sorry, Cheryl. Anthony, if you know anything about trigeminal neuralgia, drop it in the chat. Anthony says, like your crown and setup tonight. You look very Romanesque. Thank you. Thank you. Yes, I just got this. And I thought I would wear it in my hoodie for YouTube. Haven't worn it anywhere else. Thank you, Anthony. Yeah, sorry I missed you last week. Had to take a week off. Doesn't happen very often, but I try to give you guys a heads up when I do so that you're not getting on here waiting for me. Um, Okay, well, Cheryl, I hope the drugs work. I hope the drugs take away completely, and I hope the drugs don't have any nasty side effects that create other problems. Because that's the other problem with prescription drugs is like there's a caveat to it. In French, they call them secondary effects. So the primary effect is to solve the problem, and then the secondary effect is all the other problems. Cheryl says drugs make it tolerable. So does it go to 0 or does it go to like a 1 or a 2? Because 4 or 5 all the time. I mean, I would just be so grumpy. I would want to punch everyone in the face. How are you married? Like I would be so miserable. Like any other person making a noise and I would be like freaking out at them. Cheryl says drugs make it tolerable and that it's nerve pain. Oh my God, what's that from? Like, did you hit your head or something and then a nerve like got squeezed or something? I don't even know what that would be caused by. Will Susan's thingy bobber help you? What's her thing called? Let me scroll up. Will Susan's pulsetto help you? Maybe, Cheryl? Have you tried it? Have you if it's for migraines, I'm sure you've tried everything. That's the problem, right? Ooh, Susan says I just Googled that and it might. Okay. Oh, Susan texted Cheryl about that. I love how supportive you guys are. Everybody's just in here trying to help everybody else out. I love that. Cheryl, do you feel loved? Susan's looking out for you. That's awesome. I love when strangers are just like, don't worry. I thought of something to help. Um Yeah, I mean, if that were me, I would be looking for every treatment under the sun. I would be hoping to have any type of like I would just be there's a level of desperation um that I would feel. Katie says Susan is an angel on earth. I agree. Mhm. She is. Aw, Cheryl says yes, she feels loved. Yay! Go team. See, that's what Sunday nights are for. Feel a little wrapped up in the group. People care. We're here. We want to know how you're doing. We want to know how we can help you because life is a team sport and you can't get it all alone. Um Bill Burr is a stand-up comedian in the US and he used to have a joke about that with lotion and being ashy, which is a thing like black people talk about. And uh and so all the black people in the audience are laughing and all the white people are like, what is lotion? What do you mean? What is ashy? And he's like, the problem is there's a lot of information in the world and every group of people misses a little bit. Right? So maybe somebody here has some kind of migraine solution that no one else has heard of or whatever. Like with the internet, there's even more information. So you got to have a team, you know? Everybody's. Now, Cheryl, in your circumstance, I could see how putting a flower crown on your head when your head is already sore is probably the last thing you'd want to do. But we could come up with like a necklace or like oh, flower crown earrings. Ooh, that was my emergency alert. They okay, sorry about that noise, guys. Let me turn my phone off. I hate it when the emergency alerts go off and you're doing something where it's like I mean it's always really disruptive. You heard that noise, but uh it's the worst when you get woken up by it. So I try to keep my phone on silent at night. Let me see. What if I yeah, we could wear that as like a necklace maybe? Hmm? Cheryl says I can only tap on one side of my face. Oh my God. I wouldn't tap at all if I had that problem. I would be like, I'm not touching this at all. You see, could it be a necklace? There's got to be some way. We'll figure it out. It's caused by compression. I mean, yeah, I figured, Anthony, but like what would compress a nerve? Like, is it from an accident, or like does your body just one day decide to like start squeezing things that it shouldn't be squeezing? I can't believe you tap at all, Cheryl. Um, yeah. Cheryl, how can we support you? This is alarming. Like, we're all concerned. You've never mentioned this before. How can we support you? If anybody comes across a way to make your nerves stop pressing on each other. And I'd be interested, Cheryl, to know if Susan's Pulsetto thing actually helps. Or maybe you should get the implant, Cheryl, if your migraine's that bad all the time, if your nerve pain is that bad. Maybe the implant would help you. I don't know. Chewing differences in temperature, light, and touch can trigger it. Chewing. I don't chew like that. I don't know why I did that. I was just like trying to figure out where the muscles would be attached to the man. Who knew chewing was so important? That's good to know. Oh, so Cheryl said that's why I wanted to ask Susan about the vagal nerve stimulator. Oh, well, I hope we gave you a little more info. Um, Cheryl, are you getting Susan's messages on text? Text on Messenger? Yeah, because I don't know, putting the goo and the electro pads on your neck, that sounds icky. That doesn't sound nice. But I guess at any point it's going to be better. Yeah, vagus nerve stimulator, yeah. Anything would be better than actually having the headache or I assume the drugs come with side effects. That sounds horrible too. Chewing. Although, you know what I didn't know? I didn't know that breathing could change your structure, like your face structure. So, like mouth breathers, and I think I am a mouth breather, or I don't know. I don't really think about it. But people who breathe through their mouth, they can have, like, especially little kids, they can have what is it, like a weak jaw development, like their jaw doesn't come out all the way and it's like a recessed jaw just from breathing. I did not know that. I know it now, but that surprised me. No one ever talked about breathing as a kid. No, like people were like, "Oh, don't go swimming after you eat or you'll drown," or don't do that or you'll go blind. But no one ever said, don't breathe through your mouth or else you're going to end up with a recessed jaw. Like, that was new. So yeah, chewing differences in temperature, light, and touch can create a compression of your trigeminal nerve. Okay, well, that's good to know. I will be careful what I chew from now on. Anthony, how was your week or 2 weeks? How's paramedicing in Ontario going? Is it also 35 degrees Celsius there, the way it is in the US in certain parts right now? Because I was trying to explain that it sounds like America has a fever. Because I haven't heard of anywhere in Canada that is not getting winter. Okay, Cheryl says she is getting the text, Susan. So you guys can connect on that. And Susan is an angel. And thank you so much, Susan, for reaching out, because anything we can do as a group to help poor Cheryl, I am right on board with. I don't know anything about this, so I'm I'm deferring to people who have more experience, but I do I do care that it gets better, Cheryl. I can't imagine, like, how do you do anything? Like, I'm picturing like all the years I spent learning French and like trying to learn another language. Like, how would you do that if you always had a headache? Like, like how would you go roller skating if you always had a headache? Like, if I always had a headache, I'd be like, I never want to get out of bed. I never want to do anything. I would just be a lump. So, Cheryl, you're a trooper, is what I'm saying. Very impressive. Um, Susan, are you at least getting out and enjoying the summer weather in Northern California? I mean, it must mean you don't miss Hawaii that much, right? Because that is a lot of uh, that is a lot of heat. That's basically tropical. I mean, that's more than tropical. That's crazy. Susan says, "I love home." Is home Hawaii or is home California? Um, Susan says, I even when I was in Hawaii, I appreciated home in California. Okay, good, good. I've never been to California, but it is on my list. Um, Northern California sounds nice. I have thought about going to San Diego just for the food because it's right on the border, and apparently the Tex-Mex or whatever is amazing. Okay, Anthony says, okay, Cheryl, hang in here. Anthony says there's a minor surgery called a rhizotomy that helps some people that have it. The surgeon kills some small nerve fibers so the pain signal doesn't get transmitted to the brain. And therefore, the pain is no longer felt by the patient. Whoa, rhizotomy. Cheryl, have you heard of this? Have you heard of rhizotomy? Wow, so the surgeon kills some small nerve fibers just so that it stops telling your brain that you're in pain. That's a great idea. Love the surgeon who came up with that. Thanks, bud. That's awesome. Okay. Okay. Cheryl, do you know about rhizotomies? Was the guy's name Rizzo and that's why it's called a rhizotomy? Why is it called that? I'm always interested in etymology. Susan says doing some gardening, but bugs and it gets hot fast. Okay. So it just went straight to summer. Like you just didn't have spring. Nova Scotia does that, but it does it in like early June. It'll be spring for like 3 days and then it'll go straight into summer. But it's like at an appropriate time of year for that weather to be coming. I'm going to look up what it is in American, but last year it almost never went above 25 Celsius in Fahrenheit. It almost never went above 75 degrees Fahrenheit last summer. So it was just like the perfect summer. It was just every day. Every day was sunny and 75 degrees for the entire summer, which never happens. And normally it rains, but then there was a drought. So it was too many sunny days in a row, and that ended up being a problem. So you win some, you lose some. Anthony says it's 5C in Ontario. Okay, that's pretty typical for March. Susan says rhizotomy is not named after a specific person, but originates from Greek roots, rhiz meaning root and tomy meaning incision. Yeah. Root. Okay, so they're going to the root and they're cutting it and then whatever. Okay, good. I love me some original Greek root words. I had to learn Latin when I was in grade 6, and not Latin, like not the whole language, but the declensions and the suffix and prefixes and stuff. But I did not know. I didn't learn too much of the Greek. Cheryl says, no, I didn't know that. So Cheryl, oh my God, like in our little group of, paramedics and Googlers and people who are really smart, maybe there's a surgery. Maybe it's in Anthony says it's minor. So it's like I assume that means low risk, hopefully. Does minor surgery, Anthony, does that mean she's like not put to sleep? Well, not put to sleep. Oh no, that's not what I mean. You're not a dog. Anesthetized? Like is she awake? Cheryl, what if you could go to your doctor and ask them about a rhizotomy? And you could be like, there's this Sunday night group on YouTube. Anthony, you really like Anthony's basically he's not a doctor, but pretty close for our group. He is a medical professional. He is trained in a bunch of different things. Susan, think about that. Or Susan, not Susan, Cheryl, think about that. That maybe you're a candidate for that. Uh Anthony's quoting Latin. Cecilius est in orto, Latin for Cecilius is in the garden. What that's got to be from something, right? Um Okay, so Susan's looking deeper. Cheryl, I hope you're still on here because we're all we're all committed to finding this solution for you. So hear us out. Susan says another question was on Google, how long does it last? And Google says in most cases rhizotomy provides immediate pain relief that can last up to several years until the nerve recovers and is able to transmit pain. Yeah, because if they're cutting it away and then it's like, oh, let me rebuild myself. Anthony says that's all I can remember from Latin class. Did you have Latin class? Oh, I'm jealous. Um so Cheryl, this could buy you like up to a couple of years potentially. Cheryl got to take Latin in high school. That's awesome. Wow, I'm jealous of that too. Anthony took a year. When did they stop offering Latin in high school? I did do it in homeschooling. It's just not the same thing. That's awesome. Cheryl and Anthony, do you find that it helps you with figuring out like big words or like medical words, like the root of the word where you're like, oh, I can figure that out because I took Latin and I know the like prefix? I feel like it would be very helpful to have had formal Latin instruction, particularly for you, Anthony, anything medical, right? Like a lot of the medical stuff. Or like if you went to law school, like that's all Latin. Mens rea. I don't actually know legal Latin. I just watched Legally Blonde yesterday and she was learning Latin in the movie, so that one is top of mind. Anthony says yes, it helps with medical terms. Yeah, I mean it's like kind of essential. Medical, legal, just big words in general. Yeah, so like I know at least 3 legal terms from watching Legally Blonde yesterday. Yeah, so Cheryl, this is amazing. Like this could be something that you could approach your primary care physician with and be like, am I a candidate for this? And it's a minor surgery. So like can you like refer me to someone who can perform this? Oh my God, Cheryl, what if you did that and what if it worked? And then what if you came back here and you were like, Sunday night group for the win? That would be a full on like Sunday night group miracle. That's what that would be. I would be so excited if that took your pain away, Cheryl. Yeah, go team. Okay. So Cheryl, do you think you might approach your doctor with the question? Or do you at least feel hugged and supported that everyone is trying to help you? Yeah. She already said she feels loved. That's awesome. Um okay, well that's our like breakthrough for the day, I guess. So yeah, Sunday night YouTube, like whatever's going on, whatever you need help with, you never know. Between this diverse group of people, somebody might actually have a solution you haven't thought of. See, there's a lot of information in the world and everybody misses a little bit. Anthony says they don't cut out the root, probably only one of the small nerve branches off the trigeminal nerve. Okay. Yeah, so then that's why it would grow back, because the branches grow back. Yeah, well, that's fine. As long as it's minor and it gives her a couple of years of relief. I would do that surgery every couple of years. You know what I wouldn't do? Um, apparently, okay, Anthony says range of pain relief from 6 months to forever. 6 months to forever. Oh my God, this could just solve the problem completely. Even 6 months would be amazing. Did you guys know that if you get breast implants, you have to have the surgery to replace them every 10 years at least, or else they can make you sick? I mean, I think they can make you sick anyway, but so every girl you've ever seen with a boob job has to go back under the knife every 10 years. And apparently the same thing is true for facelifts. You get an amazing facelift and they like do all that, and then after 10 years it like droops again, and then you have to go in and get a full, I just, the maintenance on it, you know? The maintenance on elective cosmetic surgery is just unbelievable. Who has time every 10 years to get the surgery? Anthony said I can't get those. Um, Cheryl says yes. That would be wonderful. I feel very supported. Yay! Oh my God, you guys, I'm so happy. This is like a little group miracle. I know, Anthony. I'm just saying, like a surgery that's going to make my migraine go away for several years, I will happily get that. But having to go under and have a full, massive, like breast augmentation switch out every 10 years while knowing that they could burst at any time and make me super sick. I'm just like, I'd rather just accept my body the way it is. Like, that's just, I can't commit to that kind of upkeep. But Cheryl might be able to if it takes the pain, even if it's a few years. But Anthony said it could be forever. Like that could just solve it forever. A lot of information in the world, and everybody misses a little bit. Go team. Anthony says you have to go back to prevent wear and tear and leakage. Yeah, no. I'd rather just accept my body the way it is. I really am not up for that kind of high maintenance. Yeah, that's, I mean, it's like if it was one and done forever, I could see people considering it. But I'm like, then you have to pay for that. That's a lot of upkeep. No, I'm just gonna accept my body the way it is. That's all. I'm good. Yeah, so I guess that is our everybody's like cooperation group support for the day is helping Cheryl figuring out a rhizotomy. That's a fun word to say, rhizotomy. And yeah, like come back next week and let's see what other life-changing, possibly life-changing support we can give each other. You never can tell. You never can tell with Sunday night YouTube. Okay, well, I guess I'm gonna call it there, guys. It's been an hour. And thank you so much for coming. And maybe next week I'm gonna wear a different flower crown because I have a few more. So if you want to bring your flower crowns next week or your sparkly headbands, those are also an option. Oh, we could combine them. Well, this is looking a bit crazy. So Yeah, Anthony says she has to be referred to a neurosurgeon, but I'm sure your doctor can do that. She is in America, but that probably means they get faster healthcare because they pay for it. Yeah, okay, so thank you so much everybody for showing up tonight. Cheryl, our hearts go with you. Like, I hope your doctor is supportive, receptive, like what a dream it would be to have all the pain gone. And thank you to everyone who supported Cheryl in that. You guys are the best. Yay! Go team. Thank you, Katie. Okay, I will see you all next week. Yeah, exactly, Susan. Go team. We're all in this together, guys. Same person living a different life. Got to help each other out. All right, I will see you next week, and everybody take care and come back, and we will see what else we can support each other with. Love you. Bye.